So was going to start by saying that this meeting is being recorded. In order to protect your privacy, please feel free, again, to change anything, any identifying information you would like. Make sure that everybody feels comfortable and safe. My name is Rachel Justice, and I'm the co-leader of the Woman to Woman program at Mount Sinai Hospital in New York City. We are absolutely thrilled to have you here. Although I will be talking a lot, apologies in advance, this is very much a 7-way collaboration between a bunch of wonderful charity organizations. So in addition to Woman at Mount Sinai, we also have Discovery to Cure at Yale New Haven Hospital. We have Shersheret. We have WOCA, the Wisconsin Ovarian Cancer Alliance. We have Judy's Mission. We have MIOCA, which is the Michigan Ovarian Cancer Alliance. And we have TEAL, Tell Every Amazing Lady About Ovarian Cancer. So again, we are all have the same goal here. We all want to provide support and resources and information to women who are dealing with gynecologic cancer. You are welcome to reach out to any and all of us, no matter where you are in the country, and we will do our best to help you and support you. So again, we love the idea of partnerships with other charitable organizations that have similar missions. So we think this is a wonderful example of that. So we have 3 amazing speakers. The goal is to kind of touch on the biopsychosocial impact of a gynecologic cancer diagnosis. So we have an incredible doctor, gynecologic oncologist, who will be speaking. We have a social worker who will be speaking, and we have not a survivor. We have, hold on, I know that we have an overcomer, which is a wonderful expression, and can't wait to hear a little bit more about that. So before each of our wonderful speakers talks, I will do an introduction. Just want to let everyone know we absolutely have time for questions and answers at the end, but we do want every one of the speakers to get through their portion. So at any point, please feel free to pop questions into the chat if you'd like, and we will get to them. We're really good about making sure we answer those questions. And when it comes to the live Q&A part, you're welcome to use the hand raising feature. You can physically wave your hand. You can unmute yourself and just start talking, but we really want to make sure this becomes somewhat interactive also. So our first speaker is Dr. Angela Kueck. Did I pronounce it correctly?
Yep, you got it, yes.
So Angela Kueck is a distinguished gynecologic oncologist with over 15 years of dedicated experience in managing gynecologic cancers and performing advanced surgical procedures. Currently practicing at Trinity Health IHA Medical Group's Ann Arbor campus, Dr. Kueck specializes in robotic surgery, vulvar diseases, ovarian cancer, and complex gynecologic surgery. Her professional interests focus on enhancing surgical techniques and improving patient outcomes through innovative treatments and collaborative care. Dr. Kueck is committed to working with her team to improve the lives of women with cancer and is passionate about raising awareness for ovarian cancer. Dr. Kueck, thank you so much for being here. You are so impressive, and we're really, really honored to have you as part of this panel.
Oh, thank you. And then I'm going to try to share my screen. I don't know if that's happening. Is that working? Okay, so I'm seeing thumbs up. Okay, good. All right, so you guys can see the main slide. So it's an honor to be here and be part of this program. And I really, all the organizations you mentioned, the TEAL organization, MIOCA, do so much. And so I'm so happy to participate and basically just give a overview of how I talk to patients when I'm meeting women in the office and helping them navigate that complex gynecologic cancer diagnosis, which can be very overwhelming. And basically starting with, as you can see here with all these organizations, that you are not alone in terms of support and opportunities. And in general, 100,000 women a year are diagnosed with a gynecologic cancer. 1 in 70 will have ovarian cancer. So there are a lot of women out there dealing with the same things you are. And networks like this, I think peer support is really important to women dealing with this diagnosis. So in terms of when I meet women, there's going to be a lot of words, a lot of people they're just all new. And so I really encourage women to come in with at least one person, the support person, to be a recorder and take notes, because you're going to forget everything I just told you when you walk out of the office. I also encourage patients to record visits if they need to kind of reprocess things as well, because there's just a lot of information in the beginning, and I know it can be overwhelming. There's going to be a huge team that can be involved. And so definitely you're going to have a gynecologic oncologist on your team, but you may also have a medical oncologist or a radiation oncologist as well. And there's just a lot of support people that are available in most cancer centers, and take advantage of them. You know, if it works for you, there are a lot of other support services, such as a nurse navigator. Many programs now have a nurse navigator who can help you with appointments and just navigating the system, which is very confusing to all of us at times. In addition to myself and my partners, there are usually nurse practitioners, physician assistants, what we call APPs, who are part of the team as well, who can help me see patients if I have to run to surgery or to the ER. They're a vital part of the team as well. And then you're going to have, you know, a nurse, that's the main person in the clinic you'll be talking to, a medical assistant or scheduler. If you're receiving infusions in the chemo center, there will be an infusion nurse that you will become close with as well. Social workers are key as well. They can help kind of fill those gaps of unmet needs that you might have as well. So they're a vital part of the team. Counselors, therapists, we usually have them as well, pastoral care, just different things to help you, potentially family members, dealing with this diagnosis, or how do you talk to your children about a cancer diagnosis? There are, again, lots of resources specific for that as well. Another resource that, you know, we're using more and more is physical therapy. They can help with a lot of things, not only following surgery, but during chemotherapy, to help with neuropathy, to help with pelvic floor issues. So that's another big component of the team. You know, we're not opposed to natural therapies or approaches as well. I work with a lot of naturopaths in our community. And so I think being open with your physician about what's important to you, who you're working with, that we can all work together as a team. Acupuncture, yoga, meditation, there are a lot of other resources that are also, you know, helpful to dealing with this, you know, cancer diagnosis. Pain and palliative care, they're a special group as well who can help deal with pain issues from chemotherapy or surgery, sleep issues, other things that arise from symptoms from treatment. Nutrition is another vital, you know, component as well. So we have a nutritionist, as do most cancer centers, to help you during, you know, your treatment. Financial toxicity is huge, and we realize that a lot of the medications and things we're talking about are just really expensive, and just navigating that insurance pathway, very confusing as well. And so there are separate, in addition to social worker resources, to help, you know, manage those financial toxicities, unfortunately, that come along with cancer care. And then there could be a clinical trials nurse on your team as well. So, you know, most gynecologic cancer patients will be screened at some point for clinical trial, which is great. And so a research nurse will also be part of the team at times. So as you can see, these are a lot of people. I'm sure I'm missing some as well, who can be part of your care team throughout. And I would encourage you, if it works for you, take advantage of all of these resources if needed. So again, ovarian cancer, which is, as we know, is difficult to diagnose. So part of this program and other things is just awareness is important. Awareness for other primary care providers who don't see a lot of ovarian cancer in their practice. You tell your friends and other women in your life about what the symptoms are, so that if they have any persistent symptoms such as bloating, abdominal pain, weight changes, feeling full, changes in bowel habits, bladder habits, abnormal bleeding, you know, those can be red flags. Obviously, those symptoms are vague, and we can all have those symptoms at times. And so the key is, if it's persistent over several days, you should tell your doctor and see a gynecologist. We found that women kind of get sidetracked and sent to maybe a GI doctor, or go different pathways before they end up to a gynecologist. And so our promotion and awareness is to just get into a gynecologist first, get screened, get an exam, an ultrasound, you know, and then go down a GI workup or path if needed. And so if you have these symptoms, you see the provider, the next step will be getting some blood work or a biopsy, and then you'll be referred to a GYN oncologist. So by the time they see me, then they've usually had the diagnosis made. So they've had a biopsy. And so now we have to talk about all the cancer terms, again, that can be overwhelming. And so the next step is figuring out, we know it's cancer, what type of cancer, what is the stage? And as we know, cancers are staged 1, 2, 3, or 4 based on if they've spread anywhere throughout the body. And so we need to figure that out first before we talk about treatment options. And so we want to see where the cells are in the body. The next thing is a term that is often confusing as well. It's called the grade. And so when we get the biopsy report from the pathologist, we should go through that and see what the pathologist puts down in terms of how aggressive do these cells look. And they'll give that a score usually of a 1, 2, or a 3. 1 being low grade and 3 being what we call high grade. And those cells can just be more prone to spread throughout the body, or recur, can be more aggressive. And so that also influences our treatment plan. And that just means the cells look different under the microscope to the pathologist. So those are just some of the things we'll look for in the beginning to figure out, okay, what's our next step? As you can see, the no Google thing on there is something that should be on every slide. It's something I ask when I first meet someone of kind of, what did you look up ahead of time? If they did not look up anything, someone in the family did look up something on Google. And so just have to be careful about, what are your sources? Because there are a lot of things on the internet that are not vetted. And so we often provide, good websites and resources. There are certainly sites that are very helpful to patients navigating this, but there are a lot of sites that are misinformation and can cause more damage. And so really caution people about going on the internet in the beginning until we really kind of have, a diagnosis and a plan, and that can help kind of guide them to the appropriate sites. And then something just to bring up, that a second opinion is always okay. I often feel like patients don't want to hurt our feelings or feel bad about bringing that up. We want to know everything. And so our goal here is to be an advocate for you, to do what's best for you. And if there is a clinical trial or something else that we are not providing, yes, we want to get you to that person or place. And so second opinions are never a bad idea at times in certain cases, especially rare or unusual cases, and we'll help facilitate that. And so, the GYN oncology community is a small network. I think there are only about 1,500 of us in the country. And so, not that we know everybody, but it's a small community. So we easily will communicate with each other and collaborate and work together, because our goal is to take care of you and provide the best care for you. So again, don't Google. So now that we have the diagnosis and we're trying to figure out the stage, it really, for ovarian cancer in particular, we're kind of figuring out, like, are the cells just in the tube or the ovary? Are they still in the pelvic area? And so that's usually where these cancers start. Unfortunately, because they're hidden down in the pelvis, it's harder to find, which is why we have a hard time detecting these cancers early, just because the pelvic area is harder to detect. Unlike breast screening for the mammogram is much easier. It's more difficult for the ovaries and the tubes. And then for the advanced stage, again, the cells have already traveled outside the ovary and the tube and have spread to the abdomen, lymph nodes, and beyond. And so this is the stage that we're usually starting with for ovarian, fallopian tube, and peritoneal cancer, which are all kind of put together in terms of staging and how we approach things. So, how do we determine the stage and all of that next steps? And a lot of times imaging will be part of that plan. So there are different types of scans that you'll be talked to about as well. So an MRI can be used for the pelvis. Again, CT scans are going to be used more commonly. They're easier, they're quicker, less invasive to get. And then a PET scan is also now approved upfront for ovarian cancer patients that will routinely get as a baseline. That's more of almost a full head to toe scan to be more cancer specific in terms of lighting up the cancer cells green on the scan. And so one of these scans will be done as a baseline up front, and then down the road as well to monitor your response to treatment. So in addition to that, we'll usually get baseline blood work just to check your immune system, your white blood cell count, your liver function, kidney function, as we're coming up with a treatment plan as well. Tumor markers are blood tests that are unique for your cancer. So just as prostate cancer has a PSA, the CA-125 is specific for ovarian cancer, but it's not a perfect test. Again, not every cancer has a test. So uterine cancer, cervical cancer, they don't have a blood test. We're typically using the CA-125, and that will be something that if it's high, we can continue to follow that for response to treatment. There are some newer markers that are hopefully showing more promise as well. But for now, this would be the standard, one of the standard tests that most commonly you'll see drawn for ovarian cancer. A pelvic exam is also part of that initial process, and then depending will be performed throughout your visits to assess response as well. And then genetic counseling referral. So that's a new piece as well that should be standard of care for a new ovarian cancer patient, is that we should make sure we get you referred to genetic counseling. Not only is that important for your potential family members, your own risk for other cancers such as breast cancer, but now we're using that information to develop a treatment plan for you, such as maintenance therapy or other treatments. So it's very important, and we should be making sure every patient is referred to our genetic counselors. And that does consist of a blood test as well as testing the biopsy or the tumor itself. So it's kind of two different components. So then once we have kind of the full picture of, where is this cancer, then we talk about the treatment options. And that's usually, again, there's different options. And so it'll be a discussion. And sometimes it's upfront surgery. And so you'll see the term debulking that's thrown around a lot. And that just means removing like cancer that you can see, visible cancer. And so sometimes it makes sense to go in and remove that upfront. Sometimes you'll do it later after you've done some chemotherapy or treatment, and that's called interval debulking. And then another term you'll see out there that's getting more press is something called HIPEC. And that's surgery where you go in and remove the cancer and at the same time instill some chemotherapy during the surgery as well in the abdomen. So these are kind of the three mainstays of surgery. And again, the timing can vary just based on the other factors we talked about. And then chemotherapy is part of the picture as well. So again, chemotherapy can be done up front, or it can be done later, or both. Again, it can depend on the person and the whole picture. And so it's important to have that whole informed discussion up front, because there are some options sometimes. Chemotherapy is given through an IV, or most commonly a port, and that's done usually over 18 weeks or so. And again, there can be some side effects. And so that's why it's important to take care of all those supportive care options to help deal with those side effects. The newer terms that you'll see will be maintenance therapy. And so we know that after your upfront treatment, there might be options now for a pill, such as a PARP inhibitor, or continued IV therapy, much like they were doing and are doing tamoxifen for breast cancer patients. Now we've got our own types of treatments for maintenance options as well. So you might not be done initially upfront. Targeted therapies are, again, a whole new class of drugs that have been approved in the last several years, just to basically target the cancer cells more specifically and have less of those general side effects like chemotherapy. And so it's very new and exciting that we've got lots of, newer therapies out there. And then clinical trials. I know some people hear clinical trials and they think, oh, research is experimental. It's something that's new, they've never heard of. That's usually not the case. We're usually talking about, some treatment options that we use with something new that has been shown to have some promise. And so that's a very important part for ovarian cancer in general, our clinical trials. And so most cancer centers will have some type of trials available and the program. So it doesn't mean that we have nothing else to offer. It's actually a good thing when we're talking to women about ovarian cancer clinical trial options. And so you might be screened throughout your treatment course for different options, because there are a lot of new exciting things out there. And so once we have all of these things in pictures, we basically, we still treat each person, as a person. So there are protocols and standards, but really it comes down to the unique person, their whole clinical picture, where they're coming from, how they approach this disease, and we kind of come up with our treatment plan going forward. Because it is a journey. It's going to be an ongoing thing that we're, collaborating with and working towards. Fortunately, we have made progress with ovarian cancer. I'm happy to say, like, looking back in terms of the last 10, 20 years, we are making progress. We're making improvements. We still have a long way to go, but it's really exciting that in the last, 9, 10 years, there have been many different drugs approved for ovarian cancer and new classes of antibody drug conjugates, newer drugs out there for platinum-resistant therapy. So just a whole new array of medications that we're seeing a lot of promise. And so that's very exciting. And I think, again, clinical trials are key to keep this going and this awareness that we're doing with programs such as this. So that's all I had, and I'll hang on and be happy to answer questions at the end. Thank you.
Thank you so much, Dr. Keith. That was such an amazing overview. Again, I've been working in this field for a very long time, and I learned a lot from it. I think you had so many important takeaways. I love the put do not Google on every single slide because like how much can we not, can we emphasize do not Google, stay away from the internet. And I think you really speak to why we're having forums like this by having this live in, it'll be on our website. It'll be, I know it'll be, with our partner organizations also, people can find reliable sources of information and do not need to go and just type, terms into Google and get totally freaked out. So thank you so much for sharing. I think it's also really encouraging. I love that you ended on a positive note that, the field has changed so much. And I mean, it's changing all the time. And you're saying HIPEC is something you're hearing more. I remember the first time I heard, I was like, hi, what? I had no idea what that was. And, as you said, now it's getting much more common and, it's very exciting and, time to be in this very innovative field. So thank you so much. It sounds like you're doing fantastic work. Your patients are very, very lucky, and your parents too, I'm sure.
Yes,
to be working with you.
Yeah, thank you.
Absolutely. And I'm sure we will have questions at the end. So our next speaker is Ruth Ornstein, who is wonderful. She is actually a member of our committee in addition to being one of our speakers for this evening. So Ruth Ann, and her title is Program Manager, Discovery to Cure, Yale School of Medicine, is a trained social worker. She works daily with women in all stages of the gynecologic cancer journey. She currently leads various peer support groups, woman-to-woman program at Yale, survivorship events, educational programming, fundraising, and provides outreach to gynecologic oncology patients at Smilow Cancer Hospital in New Haven, Connecticut. Ruth Ann is an 11-year ovarian cancer survivor, and upon diagnosis made a commitment and a change professionally to give back to the community that helped her get through her initial diagnosis. Ruth Ann is also a wife, mom of 2. This is my favorite part of her bio, and a grandma to be this coming November. Again, we have the privilege of knowing Ruth Ann, not just as a panelist, but as one of our committee members and, as a friend. So thank you so much for sharing your incredibly valuable perspective in so many ways and for the amazing work that you do with the gynecologic cancer community in so many different capacities.
Thank you. Can I confirm, is my voice on?
Yes.
And you can see my screen?
Yes.
All right.
I can't, no, I don't see your screen. We see your face.
All right. Let me see how I share this. Because according to mine, it's being shared. I'm so sorry. I apologize. Did you see anything now?
We just see you. Oh, hold on. Something's happening.
All right.
We see
my psychic board here.
No, we just see oh, okay. Yes. Now we see your many open. I don't know if it's open windows or what that is. Okay. Now we have it. If you want, you can also put it into the slideshow view, so we just see the main screen that you're talking about.
I have a brand new computer, so I'm learning everything. It's a little different than my other one. So, but do you see my slide now or no?
We do see your slide, but we also see your slides on the side. So if you do want to put, like at the top, you can put the slideshow, and then we'll just see the main slide that you're talking about. So
if I saw that, we would be better. So if it's okay, I'm gonna just stay like this so I don't mess it up.
Absolutely.
All right. Thank you for having me this evening speak. And Dr. Kueck, I apologize, but I'm going to share some of the same things because I think great minds think alike. And it's just so important for us all to remember that we're not alone in this journey. My name is Ruth Ann Ornstein, and I work at Smilow Cancer Hospital in New Haven with our incredible women in our department, in our gynecologic department. The first thing that I want to start with is when you hear a diagnosis, I want everyone always to remember it's a roller coaster ride. It really is. You buckle your seat and you get ready to go. There's going to be ups and downs through it, but the most important is to remember you're never alone in this experience. And this program we're doing today is just one of the many that are there. And it's incredible because we are so many organizations together that all offer services. And if your hospital or the clinic that you're going to doesn't have everything you need, feel free to reach out to any of us because this journey keeps going. And even the end now with all this incredible maintenance drugs that we have, the journey continues. And just think of it as a roller coaster, buckle it up, and we're all there with you. And we're taking the ride with you. Make sure when you are diagnosed and throughout the process, you're getting the facts. Dr. Kueck brought it up before. You never want to trust Dr. Google, Nurse Facebook, or any of them. If you need other information, please speak to your doctor or your medical team. They will give you the accurate information to find in sites. Unfortunately, the internet is good and bad, and we just have too much resources at our fingertips, and a lot of times it's not accurate. And there's no reason to get panicked. I know how many people get their MyChart or whatever program you have, and as soon as your results are there, you're already cutting and pasting and putting it in because your CA-125 or your CBC or your iron or something. Make sure you speak to the doctor or call someone if you get concerned. Don't take it upon yourself to be that doctor to do that. Oh, when you go to your appointments, always remember how important it is to have your questions prepared. Each office has 10, 15 minutes sometimes for a patient. Make them in advance because sometimes it's very anxiety producing when you walk in there and then you leave. How many people can say that they've left after and said, oh, I want to ask this, or I want to ask that, or you have a question. Keep that, keep a journal with you. And if you're a person that is okay with another person, bring a note taker with you, or if you need to record it. Always remember that when you're in there and listening to this, it's a very scary diagnosis, or you're so excited about that things are going better and everything's in the right direction that you forget to do things. So you forgot what the doctor said. Ooh, did they tell me to take an extra B12 or a vitamin D, or do they suggest some physical therapy? And I just totally can't remember it. Have that note taker with you, have a journal with you, know what, be ready, because it's too overwhelming when everything happens at one. And I know for our hospital, and I'm sure for others also, there should be a non-urgent person on. And if something you can't wait till your next appointment, take the time to call, send a message through. You don't have to leave it to the end, but always know that there's resources out there. All of our practices are incredible and they're there for our women, and take advantage of those resources. Don't live from appointment to appointment with questions that might be building up inside you or anxiety producing. You feel a pain in your stomach, or you have some kind of discharge, or your wound didn't heal right, or you're nauseous. Call and get help. Don't wait for the next 6-month appointment or 3-month appointment or whatever. Better to call, and there's the different ways to do it. Make sure you use the resources that you have available. Again, it's communication. Just do not do this journey alone. Be honest. Now, everyone deals with this differently. When a cancer diagnosis comes up and you have young children, older children, parents alive, you're the parent, there's a lot of communication pieces, and you're learning. Everyone's learning to do this process together. Usually honesty is the best policy. And if you don't know how to talk to someone, that's where our social workers in our hospitals and in our organizations are such great resources. The right way to tell someone. You will find a lot of times honesty is a much better way to go about it than just showing up one day bald somewhere or whatever is happening. Sometimes it helps eliminate some of those questions. Or if you're not feeling up to talking today, it's okay to take charge of your own condition and say, today, I'm just not feeling up to it. We could ask questions another day. I love you. Come sit and watch a movie, come bring some food, or I don't want company today. Be honest with people. It'll make it much easier than dealing when you're not feeling well. And your loved ones will understand that also. And also what's going to happen a lot of times, and we know people always want to say, how can I help? How can I help? How can I help? Think of things that would be useful. Would it help if they go pick up milk for your cup of coffee because you couldn't get to the grocery store? Is it, do you want just company to take a walk with and not have them there all the time? Or set limits too. It's okay to tell people honestly, look, I'm okay if you come by for 10, 15 minutes, but I can't have you here for 5 hours. Or tell your family that, look, if so-and-so comes, we know she loves to talk, please help me get her out at a certain time. I can't have her that long. One thing that I did is I had a guest list. And instead of I didn't need a food truck, I had a guest list. So people's jobs were either to come in the morning or afternoon to take a walk with me. And they had a timed limit, and my family engaged with them, set them up. And so I wanted to do a morning walk and afternoon walk for as long as I could do. They were allowed to come for the walk, hang out for a few minutes, and then they were asked to leave. I set the boundaries up in the beginning because I knew I didn't want people there all the time. But we're all different people, but know your loved ones care about you and your friends care about you, but they don't have to be there all the time. This is a time when you take advantage of them or not take advantage. It's all about your healing and taking care of yourself. During chemo, as many of you know already, or if you're just at the beginning, if you're on carboplatin or Taxol and certain of the chemos, you will lose your hair. But not only is the hair one of our physical changes, our doctors don't always talk about the changes because if we're being put into menopause, the weight gain that might happen, or the weight loss that might happen, or the hot flashes that happen. Make sure you take advantages And in your notes, when you go in, ask them, what does my hospital offer? Our hospital, Yale, offers 3 massages or Reiki that are free. They have nutrition, they have available. Ask what you can have before you go out and spend your own money, something amazing at having a massage right after chemo. If you feel good and it's free, you can go down, relax, have some nice music, and take advantage of that. Does your organization or your community have meal plans? Or do they have the clean for a day that they can come to your house and clean? Or are there grants? Or what else is out there? Ask questions. And if you don't have it, it's a good thing you can give one of your loved ones to do. Say, go find out what resources are out there. Go make some phone calls. There's where you can help me. There's a beautiful place called Mary by the Sea in New Jersey. For anyone in the community, they do free programming for women. You can go away for a weekend at no charge with 7 other women. But I only found out about that from another friend of another friend who did some homework and said, what is out there for ovarian cancer patients or gynecologic patients? Ask. There's just so much out there and we don't always know, but it's okay to ask. Again, your hospital or the organizations have diet programs, but make sure no matter where you are in your life that you take care of yourself at this time. And some doctors will tell you it's okay to have a glass of wine every so often in moderation, or someone will tell you to only eat greens, or someone else will say just eat the way you do, but just don't overdo it. Or maybe the night before chemo, you don't want to eat spicy food. Every doctor has a different, or APP or your team. Ask, but take care of yourself. This is the time, the most important time, whether you have the surgery, the beginning, the middle, the end, you're on treatment for 6 cycles or 18 cycles, whatever it is, take care of yourself. The only way you're going to heal is if you take time for yourself. And it's hard because a lot of times we're mothers or we're caregivers or we're either above us, our parents or our children or wherever, and we're working, but we have to take care of ourselves. And sometimes it may mean just leaving for 5 minutes out of the room, go take a deep breath, put an app on, put a calm app, listen to music, go to the ocean, listen, watch the waves, watch the bird outside, picking at the worm, just something to take a minute and take a deep breath. Remember, we need to heal from the inside and out. We have amazing doctors who are doing their job, but they can't help us to eat properly, or they can't help us to take a walk or to take 5 minutes to take a deep breath. Just remember, we need to help ourselves. Our social workers in our hospitals or patient navigators, depending on who you have and what resources you have, there's a lot of things that come up, and finances tend to come up. Statistically proven that 70% of cancer patients go into bankruptcy because of finances. And it's really important to try to look into as much as you can and not stress yourself out totally. Find out from your navigator or your social worker, what resources does the hospital have for us financially? How do I fill out FMLA? What kind of state my state has, what kind of leave available for me? Talk to your boss, figure out where you are. But most important, understand, and I'm assuming, and I'm going to say this, that every state's not like that. A hospital cannot not give you care because you didn't pay your bill on time. There's payment plan options. I know for us here, if they can never not refuse you service to come into infusion if you can't make your payment that day or your copay or whatever. And as stressful as it is, and as many zeros you see in that bill, take a deep breath. It will all work out, and do what you can, but don't let the money make you so sick, because that's another way that you can't heal if you worry about that. And if you have a job that you can take that time for you, but maybe you don't do it full time off. Maybe some people are better off part-time. Figure out what's best for you. Have those honest discussions with your family and with the people that you work with. And some people love to work. And I know many women who feel working through the chemo has been much better than sitting home and watching the sunrise and the sunset and just watching everyone else leave and sitting home in an empty house and having too much time to think or play on the computer. But remember, there are tons of resources there, and no matter how stressful it is, the money will be there after. Obviously, electricity, gas, things like that. And a lot of times the hospitals will have some funds to help you, or your individual state might have some money to help assist you to some point. And you'll find that honesty is the best way. And a lot of these companies will even put you on a small payment plan. If it's 25 or 50, they will be much happier if you do some small payment plan than nothing at all or ignore their calls. But don't let yourself get sick over it. You're not going to heal if you're getting so sick to that point. And again, all of our organizations, depending which community you're in, some have gift cards and other resources that can help you as well. Please look and take advantage of all of us that are here with you. Again, the coping mechanisms. When we're so stressed out, sometimes we forget about how to take care of ourselves. So here are just a few. Practice different ways to relax. There are many free sites online, from the Calm app to different apps that you can have. They'll just help you to take a deep breath. Share feelings honestly. It's scary. When you're diagnosed with something like that, keep so much bottled in. Find those friends or the family that you can talk to. Get some of that out. And if not, get a buddy. OCRA and a bunch of us, Rachel actually started the program, the Woman to Woman program. So we have programs that we can match you with a buddy. All of us on here have buddy programs. There's other people out there. So maybe one of your friends or your family isn't the right one to talk to, but we can all help you find another woman who's been in this situation to chat with. Keep a journal. For many people, it's very helpful to have a journal and keep your ideas and your thoughts down to kind of get it out of your head so it's not sitting there. Pros and cons when tough decisions are made. Does your doctor giving you 2 options of different chemo treatments? Do they give you a HIPEC versus a traditional surgery? Do they want to debulk? Make a list, and then when you go into your appointment, ask those questions. And if you don't answer that day, reach back out to your APP or your doctor and ask questions. Don't accept what's there. Really figure out what's best for you and look into it. Spiritual resources. I know all our hospitals have them available, but we have our temples and our churches and our mosques. Take advantage of those people. Sometimes it's really good to just have that time in that moment. Think about working. If you continue to work for you, that works, volunteer or enjoy leisure time as much as possible. Do what feels good for you. Don't let others force you into that. And again, be okay with saying no. If you want to just lay on the couch today and watch a movie, that's okay. Just don't stay on that couch all the time. And if you find it's too much on the couch, that's when you reach out to one of us. But really know your body and take care of yourself. And most important, no one should ever feel alone in this journey. That's why it's so wonderful that we're all together here today to show you that we have so many organizations across the country, and we're only a little snippet of those that are out there. We're out there, and our ladies are out there, and they are there for one another. And I just want to say thank you for giving me the time to chat. And please feel free to reach out to me. I'll be here at the end as well. But there's so many resources out there. Please never take this as a journey that you're on alone. Thank you.
Thank you so much, Ruth Ann. That was amazing. I mean, you just touched on so many important themes and practical tips. And it was just, I mean, everything. I hope that people take that to heart, and especially people, if they're rewatching this, use that as almost a handbook for how to cope and to kind of figure out about resources. So, I think what was really interesting is that you actually brought up some of, as you mentioned, a lot of very similar points to Dr. Kueck. And I love that it's coming, not just from, a social worker, but from a doctor also. Like, these are really important. And I think that you both couldn't emphasize more clearly enough, you are not alone. And if that is the one takeaway that everyone has from this evening, you are not alone. There are resources out there, access them, reach out, become part of a community. So thank you so much for, underscoring that so well after Dr. Kueck kind of initiated the thought. So our third speaker is Dominique Cashmere Hamiliton, who is a self-proclaimed ovarian cancer overcomer. She was diagnosed at 28 years old. Dominique has been cancer-free since 2015, and Dominique recently had her first child. So Dominique, thank you so much for being here. We are thrilled and looking forward to hearing you speak.
Thanks for having me. I was kind of just hoping to inspire someone, encourage someone with my story. As was said, I was diagnosed at 28. I didn't have symptoms, the symptoms that were listed by Dr. K. Maybe just some bloating, but as a woman, it happens. So I was walking to and from work every day. That's about 2.2 miles. I've been an athlete. I played college basketball. I was led a healthy eating lifestyle much as possible. I did indulge for sure, but the way I got diagnosed was one night I had pain in my stomach. It was a familiar pain because prior to that, in 2011, I had an ovarian cyst torsion where they found 3 cysts that were wrapped on my ovary. One was 13 centimeters, one was 5, and there was another tiny one. So they did the surgery. It wasn't cancerous, and we moved on from that. But the pain that I had felt was similar. I immediately got irritated because this was maybe 3 o'clock in the morning. I was actually working towards a goal. I was waiting to swear into the military. Wanted to go to the Navy. And I was also waiting for New York City Correction to call because I had taken that test years prior. So I had a lot going on. I was paying down my debts and things like that to be set up pretty well. But I got irritated because I said, I'm not going to the hospital. We're not going. And I fell back asleep. Well, by noon that day, the pain was unbearable, and I ended up at the hospital. It was Mount Sinai on Kings Highway in Brooklyn, where they ran a gamut of tests. Again, this was my 3rd occasion with something ovarian happening. So the first one was that major surgery. The second one was a scheduled surgery on my right ovary. And this time, I kind of knew that it was a cyst because I knew what the pain was. They tested me. They did the transvaginal examination with the wand, and I knew it was different than the first time when the tech started to well up. She welled up with tears. So she couldn't tell me what was going on. She just kept reassuring me it's going to be okay. Of course, because the doctor has to tell you. So fast forward to maybe an hour or so later, they were prepping me for surgery. And I had some of the darkest thoughts because I had felt like something was going to happen. I just didn't know what leading up to. And speaking of having a spiritual backing, I was a part of the church that I was in for probably 10 years at that point, since I was a kid. So I had reached out to my pastors and told them what was happening. Of course, they lent prayer, and they took me in for surgery at midnight. Something happened in the OR waiting room. I was all of these thoughts because I knew I was gonna have surgery. So I was nervous. I thought, the worst. I had forgot that I had asked the nurse what my blood type was. And as I'm reeling through these thoughts, she kind of just skipped past and said, "Be positive." And I kind of laughed because I forgot that I had asked her what my blood type was. And I just took it as a double entendre, like, okay, everything's gonna be fine. We're gonna go through this surgery and gonna make it out. So going into the OR, I had made a joke just before they put me to sleep. I said, don't take anything that doesn't belong to you. And they did the surgery. In recovery, I can't quite remember everything that was said, but I knew the doctor, the GYN, and he had told me that they had to remove my ovary, my left ovary and fallopian tube. And then I went back out to sleep because this was recovery. The next day, when I was more lucid, I started to feel as though, because I had had the surgery before where I had stayed in the hospital for maybe 3 days after the surgery. The vibe was a little bit different this time. It felt like they had something they wanted to tell me, but they just couldn't or didn't. Fast forward, my first post-op appointment, I went alone. I'm one of those who goes through things by myself. I'm more comfortable that way. I can think clearer. But I went to the doctor. He checked my incision, but right after that, he had me come into his office. This was a first for me. And I had that feeling like something's up. And I don't think he ever used the word cancer. He had the lab report and he turned it around and he said, this is what we're concerned about. And I believe it said mature teratoma. And I had asked, well, are they saying, I sat quiet for a while. I had asked if, are they saying they got it all, or are they saying that I have it? He said, no, they're saying you have it. Oh, okay. So he never said the word oncologist. He said, we're going to send you to a specialist and we'll take it from there. I go to the specialist at Kings County. And at this point, I took my mother with me. And she, of course, she was nervous out of her mind because we had just lost 2 family friends to cancer and we had no clue that they were ill. And this is a monthly session. Like October, we lost one, November, and then December, I'm diagnosed. So we go, he looks at the lab report and he gives a, I guess, what the protocols would be for medication and how to treat it. He recommended another opinion. And so I did do that. I spoke to one of the elders at the church, and his mother had just transitioned from cancer a few years prior. So he kind of took over because at this point, I'm exhausted. And this is between the being diagnosed and going to the specialist. Between that time, when I almost floated home and couldn't think clearly. I had to initially, when I walked in, the TV was on and it was something probably too serious, which was a sitcom, and I tried to turn on cartoons and that didn't work, so I just needed silence. I didn't Google. I called the American Cancer Society, and I wanted to know the background on this doctor that I was going to go see. And so that's how I began to grab for some information. And that I had a few emotional breakdowns because I couldn't believe cancer does not run in my family. I was the first to have something like this shake our house. So we then, after I spoke to the elder, he took me to Sloan Kettering, and we went and got all of the necessary paperwork and things like that done. We set a date for chemo to start. They also had what I called an orientation. And that's when they tell you the protocol that they're going to go through, what you should have on hand, what you should do in case you have a low-grade temperature, all of these things, all of the resources that are afforded. I had a social worker, and what to expect, like, your hair to fall out and everything like this. So the elder actually went with me to the appointment, which helped because it's a lot. My outlook on it began to be, this is a new adventure. I didn't say, this is the end of the road, although I did have intrusive thoughts. It happens. It's normal. But I chose to look at it as an adventure because it's something I had never gone through, and I'm very competitive. I'd played college sports and I played for Nike and all of these things. So I looked at it as that, and I had my Nike jersey, and that was my, I guess, uniform for getting through chemo. But I started chemo the 15th of January, 2015. I was on the BPE regimen, bleomycin, cisplatin, and etoposide. And it was very harsh. I had a hard way to go with it initially, but I had to reach out to my medical team. I guess they taught me some of the tricks of the trade as far as getting ahead of the nausea and stuff like this. They had also, one of the resources was I could have my eggs frozen if, if I wanted to. I just kind of wanted to get chemo over with. So I denied that, and I said, if the Lord wants me to have a child, then it'll happen. So I get through chemo, my hair does come out. That was one of my biggest concerns when I first learned that I had cancer, and I I actually said that to my pastor. I said, my hair, man. He said, don't worry about that. Let's worry about keeping you around. So it took from January to March, they treated me. I had one hospital stay where my blood cells, my white blood cells had gone pretty low. And we came back from that. And by, let's say my last treatment was on a Friday, the Wednesday prior, I had gotten my canvas letter for correction. And so I immediately signed off on it, sent it away. And by June, because I was recovering, it had taken some time for my hair to regenerate. My nails had turned black. It was just, I didn't have, so for instance, when I was going through the process to get hired for corrections, I did have wigs, but I felt like a spy wearing them. So I had seen this lady who purposely shaved her head one day, and I decided I have a little bit of peach fuzz, and I'm just going to put on a lip, and I'm going to go to this interview. And that's how I did it, taking courage back. Just losing my hair, as a matter of fact. I didn't let it just fall out one day. I got a shorter cut. And then when I noticed that it was beginning to be too much, I took a blade to it and I got rid of the rest of it. So this is how you keep your strength and just pretty much laugh in the face of this thing that's trying to bring you down. I was then hired by correction on my birthday, June 25th. It was a really happy day. I hadn't fully recovered. I feel like I should have taken a year, to be completely transparent. I should have taken a year to, okay, I see the note, to get myself together. And I didn't. But fast forward from all of that, I ended up getting my associate's degree. I got engaged. And this year on my birthday, I gave birth to our baby girl, Riley. And I don't know if you can see her.
We can't. Oh, yes. Oh, beautiful. Oh my gosh, that is the perfect way to end that story. I mean, that says it all, that photo.
Thanks for listening to my teal talk.
Dominique, thank you so much for sharing. Again, all the professionals in the world can speak to you, but hearing directly from someone who has gone through this, and, even though it is, 9 years later and so long, you can see the emotion that you felt and it's coming back to you. And I think about, how you found out, and it seems like, you almost have a little bit of bitterness that the doctor didn't use the word cancer, didn't say that you were being referred to an oncologist, and I think that it shows that even within the medical profession, hopefully not the oncology profession, that there's discomfort and, and it's really a disservice to patients because, again, going back to Ruth Ann and Dr. Kueck's, talks, there are so many resources that are available. And from the minute you are told, you should start accessing those resources. And your story is not just one of not survivorship, but overcoming. But it's really a story of self-advocacy as well, that you contacted the American Cancer Society and you were getting information from the beginning, and I just wish you had had something like this talk to, to get you through those very beginning times. We're almost out of time. If anyone has any questions, you can put them in the chat. But I think that maybe what we'll do is I'll ask the same question of all three of our wonderful panelists. If there is one takeaway for a patient, that let's just think that, of Dominique, Dominique, that first day when she was told, was not use the word cancer, was not told, but given this information, and she knew, that there was something going on, and she took it upon herself to start finding information. What is the one thing you would want that newly diagnosed patient to take away from this? Dr. Kueck, why don't we start with you?
I mean, I think you've hit the highlights. We all hit on, like, you're not alone, but I think you need to be an advocate. And so that's probably the most important thing is don't be afraid to ask questions of the doctor or come in with a list of questions. That's great. I encourage patients to come in with a list of questions. Like I said, second opinions, get information. That's very powerful. So, to be an advocate for yourself.
I think that's fantastic advice. And I think it was a thread in all three of your talks. So absolutely. Ruth Ann, what would your
exact
main
same
takeaway?
thing is just really that you're not alone in this journey, and stand up and advocate for yourself, because nobody can read our minds. So please just make sure you share what's going on, and whatever you need to ask, or if something doesn't feel right, ask, but they're there to listen to you.
Amazing. Wonderful. Thank you so much. And Dominique, what would your main takeaway for folks be?
For me, it would be your outlook. That matters a lot. I tell everyone that I laughed through it, not saying that I laughed in the face of it being cocky, but the things that make you comfortable. Find some good company, laugh.
That's wonderful. Amazing. And I think that story about the be positive that was just a wonderful story. I was looking at everyone's face when you told that. And look, again, like you said, not to be cocky, not to be unrealistic, but as you heard, from Dr. Kueck, and, that there's so much hope in terms of, the future of care for these diseases. It's changing every single day, and connecting with a team you feel comfortable with, connecting with a community that can help you access resources is so key. So thank you so much. In terms of questions, Ashley is our wonderful coordinator here. And if anyone has specific questions for any of our three speakers, not to kind of put you all on the spot, but maybe what we can do, because we're really conscious of people's time, especially in the evening, if you want to email your questions to Ashley, who sent out the link and everything like that, she can forward them to the individual speakers and get them answered for you. So I think that would be a great way to address questions, whether you are watching this live or whether you are tuning in at a later date. Ashley, do you just want to talk about what people can expect to see in their inboxes soon?
Yes, tomorrow I will send an email with the copy of the webinar. So you'll get it will transport it onto YouTube, and so you'll get a copy of the webinar. I'll have my email on there, and then from there you can reply if you have a specific question and who you would like it directed to, and I can get in touch with them for you.
That's wonderful. And Ashley usually does a plug for kind of community organizations, and so many people now. So do you want to just do your kind of
Sure?
like
Yeah,
Ruth Ann
kind of hit on it a little bit, but
mm-hmm.
I'm with the Wisconsin Ovarian Cancer Alliance, and we have a lot of these support groups that are outside of the hospital setting. So we have a mentorship program. We can help pay medical bills while you're in treatment. Support groups. We help with holiday presents for young families around the holiday season. So try to find something similar in your community. A lot of states have their own organizations. Michigan obviously is here as well. So try to connect with a community partner, because you can essentially double dip, hopefully get hospital resources and then from a community organization as well.
Absolutely. And we have Rain, who's part of Teal, Tell Every Amazing Lady, same idea. And I love the expression double dipping, because as a hospital-based program, we absolutely encourage you to find, all the resources out there. We are all in collaboration. We all have the same goal, which is to really emphasize, what our wonderful speakers said, which is you are not alone. There are resources out there. There are communities for you. Please, please, please connect with them. Connect with as many of them as you would like. So I just want to thank all of our speakers for this incredibly valuable information, sharing your story, sharing your evenings with us, and for our attendees for being here, and also for our community partners for coming together to create such wonderful programming. As you all know, September is Gynecologic Cancer Awareness Month. Really appropriate that we're sharing this during the month of September. And please consider joining the mailing list for all of our organizations, because we want you to take advantage of any other programs we have like this and so many more. So thank you. Huge thank you to Ashley for being the administrative organizer on this, and have a wonderful evening, everybody.